So our project, which I mentioned was funded by a private foundation, the goal is to develop clinical guidelines to help health and social service providers to help their clients and patients with this particular issue. So it's a 2-year project. We're in the middle of it right now. And, we have the opportunity, I think, to help people. Primary care providers like family doctors are in a great position to talk to their patients about this issue. So we're, as always in academics, we look at the literature. We have a great working group from across the country. We're doing national surveys to find out what people actually think about this, including a survey of older adults and caregivers that's coming up soon. And then we're going to create these guidelines and disseminate them and raise awareness of this issue. These are some of the individuals on our team, and they're a really great group with lots of various experiences. Some academics, some clinicians, yeah. And you might say, well, what's the point of creating clinical guidelines? And a lot's been written about this, but they improve the quality and consistency of care and can improve healthcare outcomes. But they also empower patients, because if the guidelines are shared with the public, then patients can actually make more informed healthcare choices. They can also inform public policy and call attention to under-recognized health problems, prevention and interventions, as well as attention to neglected patient populations and high-risk groups. So, our literature, we look at all these things, not just academic research studies, but also what's been written in terms of the patient experience and promising practices that maybe haven't been researched, but are showing some sort of benefits. And so there are a lot of interventions that can be encouraged. So social programs, psychological therapies like talk therapies, health and social care provision like social prescribing, which I'll mention in a minute, befriending. There are all sorts of friendly services where you can get connected to a volunteer who's willing perhaps to connect with you once a week. Animal-assisted interventions. Having a pet can be a wonderful companion. Physical activity intervention. Interestingly enough, if you exercise, especially in a group, this is really good for you. Leisure skill development, hobbies, and then of course technologically based interventions, which so many of us have used during the pandemic and which we're using right now to connect us. So a lot of these have been found to be helpful in terms of people who are isolated. And social prescribing is a means of enabling primary care services to refer patients with social, emotional, or practical needs to a range of local, non-clinical services, often provided by the voluntary and community sector. And studies have shown this may reduce depression and also isolation and loneliness. So there are scales where you can actually fill out a form like this very simple one. It's a loneliness scale. Or much more involved tools where we can detect and understand a person's social network and measure it. But these questions in red are very helpful, I think. So is there someone available to you whom you can count on to listen when you need to talk? Or is there someone available to give you good advice about a problem? Or is there someone available who shows you love and affection? And so on. These are really important questions. So it's not just about, how many times a week do you see people, but what's the quality of those interactions? And there's not a lot that's written from the patient perspective or the individual older adult, but what our research showed was that they report difficulty locating and accessing appropriate services and a lack of personally meaningful and culturally appropriate intervention activities, and that's so critical. So there's a lot of material out there that's been provided to help individuals. This is simply encouraging people to talk about it, because there's a bit of a stigma around loneliness. A lot of people are ashamed to feel lonely and don't want to talk about it. And what this simply says is, it's okay to ask people about it and to encourage them. And if we're open, and we have the campaign in here in Canada, Bell Let's Talk, about mental health issues, and it's similar here, that we should ask people, if you suspect someone might be lonely or isolated, we should ask them how they're doing and whether this is a big issue for them and how we can help.